So a lot has been said in terms of the personal hygiene that people have to observe. And I'll put it to the panel and be as candid as you would, as you've observed the information going out there. And by the way, by the directive of the government and the Ministry of Health, there are some infomercials that we have been running and will be running free of charge because it's good for the public. And in your view, Daktari, have you seen some things in our line of duty and cringed, perhaps as to how we are going about our work and in our dissemination of information? Are we at a 10 out of 10?
Certainly not 10 out of 10, but a good score, I would say. I'm happy to hear that you're going to be running infomercials for free. I know TV time is expensive, so if you're able to spare some, that will be quite good for the public. There are stories I always see, and I want to confirm if they are true.
Yes.
And one we were just discussing before is the story about the Kwale man who was beaten to death. When I read it, I was like, is this really true? And I think Mwinzi could shed a little more light on it.
And we'll get to that, yes.
I always have some of these stories, and once I read them, I'm like, is this really true? So I still have those questions. But generally, I would say the media this time around has done a very good job.
Okay.
And I think one of the challenges that has been for everybody else, including the mainstream media, is social media. And that's where our main problems are. Not mainstream media, but social media, where we see everyone is getting all manner of information, and even people who are supposed to know better are gullible, and falling for the fear, falling for the misinformation. And I think maybe that is something the mainstream media should try and take on, not necessarily to compete with, but to counter any false information that is spreading in a timely manner.
All right.
I think that's something we haven't wrapped our hands around.
And Mwinzi will tell us how he's perhaps facing this particular challenge from the health desk and the science desk holistically from Nation Media Group's perspective. To you, Dr. Muredi, as you've been following the coverage of it, are there some areas that were perhaps maybe dwelling too much on and neglecting others?
Well, again, it's not 10 out of 10. We are getting there. There's always room for improvement.
Yes.
But it's very impressive that now it's on, first of all, on everybody's lips, coronavirus, and what to do, washing of hands. So that's fantastic. But I'd really like now that emphasis, how we, first of all, washing our hands. I know there's hysteria that we've run out of sanitizers. I've seen in a news bulletin that there are fake sanitizers that the government has seized. So at least I'd like us to really emphasize simply soap and water. Whether it's panga soap, sunlight, whatever you can get hold of, but soap and water is very, very crucial, and it can really go far. Because now there's that fear of, oh, they're running out of this. Social media, I don't know. It's not a unique problem for Kenya. It's a worldwide problem. In an era of fake news, things are happening, and we are watching them happen. So it's 24 hours junk that's probably up every day, every time, as even Trump suffers with fake news. But that's where now you come in and really try and counteract with the facts, with and I think with the facts, the panic, the hysteria that could be generated would really go down. So yes, we are getting there. Fantastic that you're running the ads. I saw the Dettol ad, which is really good, using common wananchi, showing people how to wash their hands.
Right.
Again, that's fantastic. So we are getting there.
Mwinzi, not 10 out of 10, clearly, but on the issue of the fake news, just some of the things that we are putting in place to fight it as NMG.
The first is that we are trolling the net to check what fake news people are posting there and then debunking it, saying, no, this did not happen, this is not true. No, you're not immune to this if you're black, for instance, or just because you live in the tropics.
Yes.
But I think there's something that she said that is quite interesting, and that places at the center of everything that is happening. And she says that it's our responsibility to counter, and that's what we've been doing, to counter the misinformation on social media, all the rumor mongering and fear mongering that is happening there. We sit at a position where we can have conversations with specialists, whether doctors or people in the Ministry of Health, or even the World Health Organization, to tell us what is happening around around COVID-19 and all that. So for me, I see journalists, for once, sitting up and saying we are running with this story. We are not letting the social media dominate coverage. We are not letting social media run away with untruths. We are sitting here and we are saying this is the true position as far as this is happening. There's a lot of people, for instance, even on social media now, who believe that there is no COVID-19 in the country.
Yes.
And they are propagating that. And the funniest thing is that they have evidence. They have evidence that we do not have coronavirus in the country. So as journalists, it's our responsibility now to say, look, guys, we have the information. We are in touch with the relevant authorities. We are talking to the doctors. We have access to institutions and facilities that you do not have. We have access to Mbagathi and to KNH that other people do not have. And we have evidence that this is happening.
It is
so
here,
it's our responsibility now and our time to run with this story.
Okay, and so something that now the Media Council has stepped in to make a recommendation, and you will tell us if it is something that will actually protect us. And it's your duty as the head of the health desk to make sure that the team here is protected. And one of the things that they're proposing is the live coverage that we've been having, the live updates from the Ministry of Health, even from the President on the situation at hand, should now not be covered live in terms of having the journalists, a battery of journalists at a particular press conference, but to have it done online. And for you, as far as our protection is concerned, there's also that other thing of having a mic to your mouth and asking you a question. Are we endangering ourselves?
Certainly yes, because if you have too many people of any kind in a crowd or gathered together, if one person is infected, then they expose everyone else. So if we can avoid any kind of crowds, any kind of gatherings at any cost and still be able to do our job, that would be great. So I would say if you are able to do a press conference online, even if it means you have to send people, maybe very few would be at the site of action,
yes,
but many more could be online. And we've seen even the World Health Organization doing their press briefings with people across the world asking questions, getting opportunities to ask questions, even from overseas, very far away from where they are. And it would be really a good thing. And we also should, that should not be limited to the media. We also should see that in other institutions. People are holding meetings and other briefings can adopt the many tools available online to do this. And now our internet is much better.
Yes.
We should be able to get work done, a lot of work done without necessarily meeting face-to-face.
Face-to-face. Yes. And thank you for coming face-to-face with us on this panel discussion. Yes. Dr. Mwinzi, your view on this?
So if you have to meet face-to-face, because sometimes you really have to,
yes,
can we maintain a distance? I love this distance. We're at least 1 meter apart because of the nature of the droplets. So it's fantastic. And that should be maintained. I saw the president, was it on a few days ago, standing with the CS, but it was very well arranged that they all stood 1 meter apart. So so we really have to maintain that.
And it'll go some way in protecting us.
And it'll go, a long way. I'm seeing in the US, when the president is making the daily announcements, I was reading that reporters, they take their temperature readings before they enter that press room. Again, that's a superpower. Probably that virtual online thing probably will not really work, but at least they're taking those measures.
I mean, look at the shots that we're having here of people on the streets. Practically speaking, should I walk on the streets like a crazy person, telling someone, "Wait, songa kidogo bana, 1 meter, 1 meter"? Practically speaking, for a person who has to be on the ground on a daily basis, like kufanya biashara or any other meetings, what do you advise a Kenyan in this situation? I'll start with you.
Again, first, if you really have to go to the streets, maybe this is where you get your daily living. First, observe. If you cannot observe those distances,
1 meter distance,
maintain at least the hygiene measures we're advocating for. Regular washing of hands with soap and water. If you can't get access to that, sanitizer with at least 60% soap. Again, there are social, behavioral, economical factors that will go into that. But we can observe that if you have to sneeze or cough, make sure you have respiratory hygiene, where you cough on your elbow and use a tissue instead of a hanky. So try as much as possible. If you really have to go to the streets, observe these measures. I'm seeing in China, in Wuhan, I was reading a story how when they have to go out, they have to wear their masks. They avoid several things like touching lifts. So this are probably, we're not there yet.
Yes.
We have to go with a mask. And please, we don't want to see people wearing masks in the streets.
I'll get to you on how we're doing it in the office and for our colleagues at Mwinzi. But my goodness, it's almost a crime now to sneeze in the office. I've done it a few times today, or even cough. You have those stairs. But practically, for Mwananchi, you're using the matatu, you're on a PSV. what do I do to protect myself? And this is information we need to give them on a daily.
The first thing for you to deal with any danger is to avoid it. If you can, where are you going? Do you have to go? If you have to go, then you could choose to travel at times when vehicles are least congested, if you're using a public service vehicle, or if it's a place you could walk, you're better off walking. That is also healthy, of course. But if you are have to enter a public service vehicle or any other vehicle for that matter, I think now they are providing a facility for cleaning hands of some sort,
yes.
And the vehicles themselves need to be cleaned frequently or regularly. That helps a bit. But generally, if you are in that closed space for a long time, there's always a risk that if one person is infected, they can infect the rest. And I like the tracking, or should I say the documentation that I think Kisumu has introduced for recording sort of matatu manifests, so that if you have to track people, it is easier. So avoid it if you can, and if not, then shorten the period you have to spend there, so that if you are traveling, you travel at off-peak times or either much earlier or a bit later,
yes.
So that you avoid too many, basically spread out the traffic. That could help. I've noticed the traffic has gone down, but
yes.
It may just be private cars, not matatus.
The matatus, yeah.
And because there are people who are still out there. Some people have been told to stay home, which helps, but there's people out there. Try and maintain distance whenever you can, and avoid this congregation we often see in our social circles, where people just meet somewhere and start making a story, because every time you're in a crowd, especially sitting close together, that's a risk.
Right. Okay, and Mwinzi, just before we get to the quick fire questions, this is on the next part, I'd like you to conclude, and as we look at this first part, as we look at what the Media Council has said in the statement for my director to just put it up, to tell us practical steps you've put for our colleagues, the journalists. I'll
answer that question in two ways. First, yes. I'll look at the general assumption and the general advice that we are getting, that technology can actually solve the press conferences headache. And then I'll look at what we are doing in the newsroom. Today, the AU invited us for a briefing online from Addis Ababa. That briefing was a lot of ministers, finance ministers from the continent were supposed to take part in that briefing. We spent about 30 minutes, 30 minutes just fiddling with microphones and, checking whether you're available. Can you hear me? Yes. No, I cannot hear you. Togo, Chad, can you hear me? South Africa, can you hear me? And eventually, I had to leave the conference. I did not get anything. I did not have the time or the patience to go through that. So technology is good, but unless and until we have it right, then it is not going to work. Right now, we do not have any infrastructure that tells me, for instance, that Afia House can set up a conference and the CS just goes there and talks, that I can receive that
clean
and
feed.
Talk back to him from the office. It's not available. I come from the school of thought that tells me that as a journalist, I have to go where the story is. It's my responsibility. It is what I went to school for. Yes. It is what I live for. It is what I wake up in the morning for. So I have to tell the story, and I have to go where it is. Of course, we also say that there is no story worth dying for. So we are taking precautions in that regard. And that is why, for this newsroom, we've equipped our reporters, especially the people who are going out to the hospitals, who are talking to the patients and all that. We have bought protective gear, hazmat suits, masks, anything. We are protecting them and ensuring that once they go and they come back, they have, they have taken the safety precautions to ensure that they remain safe. However, that is not enough, because as long as you're exposing people, to risks, there is also the psychological aspect that comes later on. Do I have it? People, the panic attacks that you're talking about, they get worried and all that. So then you also have to ensure that if need be, somebody gets psychological counseling. Go see a psychologist. Just talk about what is happening. What do you feel? If you need to be tested, if you need to be reassured, and all that. So that is important. However, I must insist that as journalists, we cannot sit and wait for a press release to come. I mean, that is not journalism.
Yes.
We must go and look for that story. By the time the press release is coming, it is only helping us tell the story that we've already gathered from the ground. that is key as far as this conversation is concerned.
Okay, and
Yeah.
I appreciate my colleagues.
And before
Yes.
I think there are other conversations that we must have. You know, should we have safe places for our journalists? You know, when they go to the field, should we allow them to go back to their families if they feel they are not okay? So
They
those
feel
are
that they've
conversations.
exposed themselves.
Yeah, they feel they've exposed themselves. Should we let them go? If not, what can media organizations do? So the statement by the Media Council of Kenya, which I told them, and I told them I do not agree with this. I do not agree with the suggestion that we should not hold press conferences until we have the right infrastructure to ensure a smooth and timely flow of information.
Yes, because with the vacuum and in this time, then the fake news takes over, and we don't want that to happen. And